There we go. All right, good morning, everybody.
Good morning.
Good morning.
Good morning.
All right, my name is Paula Whitaker, and I'm with the Hawaii Autism Foundation. We really appreciate all of you guys being here. We're very thankful for these experts taking some time out of their day to answer questions. This is a time with a lot of uncertainty, and we want to make sure that everyone's questions are answered. I have everyone on mute right now automatically. You can unmute yourself if you need to speak. That feature is in the bottom left corner of your Zoom. Also, I want everyone to please take a minute to turn on the chat function. That is also in the bottom menu of your screen. When you hit chat, it will bring up a box to your right, and that will allow you to see comments that are being made. I have all of the questions that were submitted, and I will be asking those of our experts for them to answer. If you think of additional questions during the time that they are answering, please type them into the comments in the chat box, and we'll make sure those get answered. Also, if you have something you'd like to share after our question and answer time is over, if there's some information that you think might be helpful to the group, let us know that, and we'll circle back around to you then as well. I am recording this, so if there are members of your family or group or community that are not on this call that would like to see the information later, it will be available on our website later today. So I would like to introduce for a minute our experts. First, I want to start with Daintree. Daintree is with the Hawaii State Council on Developmental Disabilities. Daintree, are you there?
Yes, I am.
Okay.
Hello, everybody. Thank you so much. I see there's about 25, 27 of us here, so I really appreciate that. I'm the executive administrator here at the State Council on Developmental Disabilities. And what we hopefully can provide to you folks is best promising practices that we have found from other states and what has been working across the nation, and sharing it with Hawaii to kind of help us with some templates of how we're going to go forward with addressing the needs of our individuals with IDD during this COVID-19 pandemic, I guess. Most recently, we sent out a update on why a DSW is considered an essential worker. And I think Mary Brogan's on, and she could go into a little bit more detail with that. I've understood that the DD division has the same view as the DSWs are essential workers. And so I think that was something that was very important to make sure our legislators know about. I do have my staff following up with some legislators to make sure that they're supporting Congress's efforts to make sure that funding will maintain through Medicaid for the DSWs. And we sent out an alert that the ARC National sent out, and they're one of the individuals that we work with in regards to essential workers. So that's kind of what we've been looking at through the weekend. Is that about it, Paula?
Yeah, thank you, Daintree. I'll introduce Mary. That's a good segue to Mary. Mary Brogan from the Department of Health. Mary, are you here? Mary, is Mary on yet? Okay, we'll circle back to Mary then. We also have Pat Morrissey from the UH Center on Disability Studies. Pat? Well, we had Pat a minute ago. Pat, are you there? All right, well, we may be having some technical difficulties with Pat. Oh, there you are.
I didn't know I also had to turn off my mute button, slide control. What we're doing here at CDS is we're basically evaluating where our various projects are. There's 23 projects and 7 contracts. And we're looking to see what we can do remotely and what we can do, what new things we can do. I have written to federal agencies that impact our projects and asked them if there's flexibility in uses of funds. The two things that I think are important to us are the staying connected with our project participants, even if in a remote fashion, as well as giving assistance to families in other ways if the federal grants would allow. I was directly involved with Katrina, 9/11, and the 2006 floods when I worked at HHS. And in those situations, we did have flexibility in how we use our funds. I think the also families below line want to make sure they have access to food.
Pat, excuse me for interrupting. I'm so sorry. We're having some trouble with the mute feature. When I'm muting all, Pat is also being muted. So if you are not muted right now, could you please mute yourself? That is on the bottom left of your screen. Just everybody hit mute except Pat. I'm not sure why it's not working, the mute all.
Okay. And so I don't know what you heard and what you didn't hear at this point.
We heard most of it, Pat. It was just getting a little jumbled.
Okay. The thing that concerns me as an individual and a professional is that I think we need data. And what I encouraged all of you to do is share in a short form your personal stories and put them on the web. I'm going to develop what I call a profile sheet, which is sort of like tell your story and say who you are and indicate what you need that you don't have right now. And because at the end of the day, we're going to need the data that on the impact of this virus, and it may help agencies become more prepared in the future if we have similar circumstances. So the impact, like we're experiencing today, will not be as substantial. Thank you.
Thank you, Pat. All right, I'm going to start going through these questions and see if either Pat or Daintree, whoever is most qualified to answer or feels like they have an answer. So the first question that most people have, well, what are the anticipated changes that we can see to DD services in relation to the COVID-19? Daintree? Oh, I'm sorry. Go ahead, Pat.
Melody or Daintree might really know about this.
Yeah. Daintree, do you know what the anticipated changes for DD services will be?
I do understand that the ADH programs was one of the first things that it was left up to the programs about closing or not. And it is my understanding that all the ADH programs have been or will be closing. And so just based on CDC's recommendation, plus on our mayor and governor, no more than 10 people gathering. So we're looking at how we're assuring that individuals are still getting the supports they need in their homes. We did have an email sent out when I followed up with Mary Brogan, and that's why I was hoping she'd be call. She's really the expert in this area. Our Eileen Manuel might be on the call, and Eileen might be able to give us an update on that. I just don't want to misspeak on that because they're the ones who is going to implement. I know we did send a ask out about the consumer directed because we have individuals out there that could support the families that aren't allowed to go to work, but they can't become a direct service worker for a family that needs that. It could be a relative that lives in the house that can support them. So it could be a win-win. But I know Melody and Cynthia both have been working directly with Mary Brogan and Acuum in order to expedite some consumer workers to make sure we're meeting the health and safety of the individuals. Mary Brogan also talked about CLS community versus independent, because we don't want our guys going out into the communities. Are we going to modify that to keep them safe? So those are the big ones right now, but we're really looking at supporting an initiative of the council across the nation, consumer services, and to make sure that they're able to do that. So that's one of the changes I saw. Melody or Cynthia, was there anything else you learned from the conversation with Mary?
Yes, Melody, can you talk now?
I'm on the conference meeting.
So what did you want me to talk about?
They said, you want to talk about your overall story about what you know about moving ADH hours to over to Consumer Direct and how you helped us speed things up?
Well, I don't know about too much about the ADH part, the PAB and the CLS. That's what I had to do with my workers. So what I did was I got my PAB and CLS hours to be moved over to Ackerman, well, to get Consumer Direct hours. So I had to call my caseworker and I said, just in case my agency is gonna close their PAB services and CLS services, I wanted to make sure that I had services for my son. So if I could switch over, once I find out from my agency that they will no longer service, I can switch over to Consumer Direct. So at first it was gonna take 6 to 8 weeks. But somehow Mary talked to Ackerman and then they figured it out to do an emergency situation. So now they're doing, I guess, Ackerman, do you want to talk about the services and how you're switching it over or what you're planning on doing? Arlena? I know she's on. Or even Mary?
I
What
could
was this
tell
for?
you, this is Cynthia, parent. I could tell you what I did so far and then they could talk on their end. I could say what the parents are doing.
Okay.
Melody told me to call. She had been on the email chain speeding this up for us as what she does in the Keely Foundation is she helps parents. So she told me to call Acumen, and Acumen I did, left a message, and we could provide that number to you. This is if you want to do your own Consumer Direct. So if you feel like you want to pretty much isolate at home, Consumer Direct is a possible way to go. So my partner is going to be the employer and I'm the mother, I'm going to be the worker and I'm allowed to do that. So so we called Acumen, they called me back on Saturday and they now take the information over the phone from you and rush this thing. And then you need to call your caseworker. So it's a two-part thing, getting permission from your caseworker who's part of the Department of Health and going to the company called Acumen, which does all the Consumer Directs. And they're doing their best, as Melody has explained to me, to rush this. I'm gonna mute.
Okay, thank you for that. I'm going to get back to these questions. And Daintree, you might can answer this. Several people, they mentioned contacting your caseworker. Do we know if...
I'm sorry, this is Mary. We
Oh,
had
hi, Mary.
difficulty with the number that you had sent. So I found the other email with a Zoom link. I'm on now, and I think that MedQuest will be joining shortly. And I have a presentation.
Okay, go ahead, Mary. Thank you. This is Mary
So-
Brogan from the Department of Health, everyone. And again, if you are not muted, would you please take a second to just mute your computer? There's several people who still aren't. We're getting a good bit of background noise.
So
Mary, Eileen is also called in, so that's good.
yes, we apologize. I gave her the email that we had, and that told us that the meeting was last week already. So then I found the email with the link. And thank you, Cynthia, for sharing the information on the Consumer Directed. We have worked to streamline the process as much as we can. We're developing operations. It's like driving the car as you're designing the steering wheel and all of this. So thank you. I have a hoping people can put their phones on mute, either *6 or just mute in the left-hand corner. So what I've done is I've done a short presentation, and if you don't mind, I'll share my screen now.
That's fine. Thank you.
Okay, so just click on that. Okay. You click on that, and then it's everything is like the same as a regular.
So can you all see my screen?
Okay, but select COVID.
We can see it. Yes, Mary.
Okay, so I'm hoping that this will answer a lot of questions. It's kind of at the high level, and it's also a little wonky, but let me know if you want me to slow down or if you have specific questions. There'll also be a time to do that at the end.
It's not transferring.
Guys, once again, please mute your phone, okay? Thank you.
Okay, can you still see my presentation?
Yes, we can, Mary, yes.
Okay, thank you. So just a little bit on, we operate, this is really from the waiver and Medicaid program perspective that both MedQuest will be answering questions about, and I'll be presenting about. We operate the Medicaid waiver for people with IDD on the behalf of the MedQuest division. And in normal times, we operate under what it says in the waiver, what the federal rules are. When it comes to an emergency like a pandemic, there's something called an Appendix K to the waiver, and it allows those temporary flexibilities that need to happen in order to provide services under these kinds of circumstances. So that's called the Appendix K. So any changes in that Appendix K, what we write into it, are done for the period of the emergency. So in this case, it's the declared emergency by the federal government. So that was done earlier in March, and so that emergency period is now. And the other thing in terms of the way to work is continue to work with your case managers. We have set up our telework or work in the office for essential workers. The case managers and the unit supervisors in our kind of food chain will be continuing to work with families during this time. So that's important to know. And I'm going to be talking about the content of the Appendix K, what we put into this application. So again, various allowances and flexibilities are allowed during this time. We did it together with MedQuest. We have submitted our 1915C Appendix K to the Centers for Medicare and Medicaid Services. They have received it. We actually have a call on it today. There's a broader plan for all of Medicaid called the 1135, which all works together to be able, our goal is to make sure that people who need services get them during this time. As you know, a lot of this is going to be done in homes and residential settings. Very little, if any, I don't think any is going to be done in ADH programs, but these flexibilities that we've asked for will allow us to retool, retrofit, support our providers during this time. So a lot of moving parts to this that we're in the process of addressing operational guidelines for. So very quickly moving. We wrote it last week. Only 3 states so far have been approved. And I think that we're going to be one of the very first states to get those flexibilities. Again, we have a call on it. Eileen, who's on the this call, also and I and a few other people have a call with CMS at noon today. So again, moving very quickly. So I categorize these things by issues. What's going to happen with these various things during the period of emergency? What are the flexibilities we need? And I will try to get this presentation posted up to our website. So just Google DDD. It won't happen immediately, but it'll be available to you. So in terms of ISPs, they may be conducted what we call electronically, but by platforms such as this, Zoom, and there's other flexible platforms that can be used to conduct these meetings. And during this time, they may be extended because we may not be able to get all the ISPs in this kind of way because some people may not have the capacity to do things electronically or through what I'm calling teleservices. They also may be done telephonically. Check-in and follow-up, case managers may conduct, again, electronic follow-ups. Level of care redeterminations may be extended. The CISs, we're getting the CIS reviewers set up to do things more toward on the telehealth platforms. And for home visits, there may be some restrictions, especially in licensed and certified settings, to ensure infection control. And again, telehealth model, you see that over and over again where it can be done. There's some services that can be done this way, some cannot. Some people need to really have the supports directly with the person. So we've done a lot of things to try to bring up and support the provider network to retool and to provide things in home. So the next issue is many individuals are going to be staying at home. So the various operational strategies that we put into place is to streamline the process to convert things that haven't been done previously at home to become PAB and respite. There will be flexibilities around hours because, in terms of budgets, what we pay for in ADH is different than the cost of providing PAB. So those are the flexibilities that we are putting in place. And then for licensed and certified homes, we have a service called additional residential supports that we will be offering to providers. As Cynthia so eloquently presented earlier, we are working to streamline the processes for CD employers because it may be that families may want to use other family members, other people that they can find to do consumer directed. So we're able to do that. We're able to streamline those processes. Still, parents and guardians can't be the worker, but they can be the employer. And so we've, inspired by Melody and Cynthia, we really got an early jump on working with Acumen, who is our financial management service, and our CD staff to streamline these processes. A lot can be started telephonically. And then agency providers, we're supporting them. We're meeting with them to allow them to provide services more in the home and telephonically. So I know this probably brings up more questions than answers, but I want to give you the broad flexibilities and permissions that we're able to do through the Appendix K that we wouldn't do on a normal day. So this is, for a lot of you, would be of interest in your homes. And then we have a whole group of people who live on their own. We're able to permit 88 services to be provided in homes. So those workers without going through a whole lot of bureaucratic issues. We'll be able to provide those services in home, either face-to-face or it can be done through teleservice check-ins with people. There's a lot of people that really can do well with a Zoom connection, either with one or two people on that call or more, but those can be provided in the home where it works. Again, telehealth, individual budgets, they may be exceeded during this time, and we'll have a process for this, because the change might be from the group services to one-on-one, different cost impact on people's budgets. For respite, we're going to suspend the respite limit and expand the respite settings. So it could be done in the home of a neighbor with an agency providing the respite worker. So again, we're working on getting those operational explanations out for all of this in the next several days. It doesn't mean that we can't start these services where they absolutely need to be started, because again, our application goes back to when the emergency was declared. So providers will get paid, work through your case managers. And I need to say, you guys are the first guys to be receiving this presentation. Again, we just submitted the K. It hasn't even been approved. All this is subject to approval, but we want to be able to push things out where they belong. And if you talk to your case managers, they're getting this presentation tomorrow morning. So be patient with them. So these are in licensed and certified homes. Some of you, your loved ones are in these settings. Again, additional residential supports. We're going to expand use of those, fast track the approval for that. ADH services can also be provided in those licensed or certified settings. The ADH provider cannot be a household resident. Telehealth again, and again, people might be concerned about the budgets. They may be exceeded to accommodate these changes in services. It's not that we're going to start, authorizing everything, but it'll be that the ability to move things over to higher paying services and provide the additional services when needed. We're also looking at the what we're doing now in terms of pre-authorization. When providers need to get things in quickly, they may not be able to wait for that pre-authorization. So we're also going to develop operations.
700,000 of the formerly incarcerated will remain unemployed for over a year, and more than 50% of
I think we're getting.
You guys gotta put your thing on mute, or nobody's going to be able to hear this. In the lower left-hand corner, there's a mute button.
I think I found it.
Oh,
I think
you muted them. You found them.
I found them.
A culprit. Okay, thank you. I've been on so many of these Zoom calls that's the classic line. Please mute your lines.
I know.
Okay, nursing supports. I want to first draw your attention to the right-hand side, because as you all know, skilled nursing services for up to 22, those are covered under EPSDT. I don't know, Eileen, if you want to say anything about that, but can you validate that those will continue to be provided through the health plan?
Hi, it's Eileen. Can you hear me?
Yes.
Yeah, so that is correct, Mary. That is considered in EPSDT benefit, and Sharon is also on the line. She can go ahead and confirm that as well. She is our subject matter expert on the child benefits for our population, our Medicaid population. So, but at this time, yes, I can confirm that. And any other questions moving forward in regards to benefits for children, you can direct those questions to Sharon.
Mhm.
Mhm.
And also the healthcare benefits for adults that you would normally get through your health plan.
Correct.
We're not going to provide them, but in terms of people who need private duty nursing, one of the flexibilities is that people may need more. So the requirement right now that we have in the waiver that participants must receive another service, another waiver service in order to get private duty nursing. We're suspending that because there may be times when people who are not receiving another waiver service during this time will need nursing. And some of the limits on private duty nursing will be suspended. The per day short term. So this is a short term episodic type of service. We're going to suspend that all with an eye on ensuring that health and safety. Now, the overlay of all these services are that still need to follow the CDC, Department of Health guidelines should somebody get sick, of making sure that you work through primary care physician before asking for a COVID-19 test, and those public health type of things are the overlay for people who may be exposed or impacted. So that's nursing. Infection control supplies. We've under a waiver service called Specialized Medical Equipment and Supplies. Will provide coverage for PPEs, personal protective equipment, and infection control supplies. When it's, the first line is to go through your health plan, and the second is to come to the waiver for these things. Knowing that all these things are in tight demand and not always available. I think that's a broader discussion that we're having with our partners. So next steps, we're waiting for the federal response. We do expect approval because I think we have a very good application, but there may be parts that CMS will ask us questions about at noon today. Over the next few days, starting today, we're developing all those operational protocols, pushing out instructions to case managers, to providers, and to our to Conduit and Acumen. Conduit is the one that manages our claims, so there are operational things we need to do around the system side of things, like prior authorization, and continue to work with your case managers to determine what supports you need. We have told people that they need to get over their squeamishness about using emails and phones during this time, because we need to, and we have Zoom lines pushed out to all the units. We also have Skype in our 365 platform. There is FaceTime, other ways to talk to people. But Office of Civil Rights is suspending a lot of the HIPAA requirements and recommending these. They are not going to be doing their HIPAA police stuff during this time. And sorry, I'm a little uncensored at this point. I've been working 7 days a week, 12 hours a day during these past few weeks. But there are other platforms that Office of Civil Rights is recommending. There's, I think, Google Hangouts and other things that we're going to be sharing with our providers to make sure there's enough platforms for communication, because that's the key right now, is being able to communicate. If people are having emergencies, it's back to 911, calling crisis services. But the fact that I can't get something authorized is probably not a 911 call. It would probably be a call to supervisors or emails to supervisors. So thank you for your attention to my breathless presentation. Wondering if there are any specific questions. I know that you guys had a lot of them in the email that got sent out, and I and MedQuest are glad to, or Daintree and Pat are here to answer any questions that you might have.
Thank you, Mary. That was really helpful, and that's a lot of information that actually answered a lot of the questions that people had. One thing I see on here are several people had concerns about respite opportunities if the primary caregiver falls ill. I mean, that's sort of a nightmare scenario, but if that does happen, do you have any suggestions or comments about that?
Well, I think that it'd be working with Department of Health. So, because I think the guidelines are if somebody in the household falls ill, that other people would be part of that circle that would need to be tested, put under quarantine, and they suggest keeping people together. So it depends on the how ill, and I would be, because our part of it is not the public health part of it, is taking your direction from Department of Health. And then if we can help support people, like if they say, okay, to move that person, okay, to move people out, then we'll talk about the, infection control or other settings. And so we'll get some, when we can, some coordination going with DocD about general guidelines, but my answer to that today is to be, and this is fluid, to work through Department of Health should somebody fall ill. And they are very clear about their instructions to people. Now, what we know is some of our folks don't do well during changes. And so it's going to be then working with your case manager and providers to see within those infection control guidelines, quarantine or self-monitoring guidelines of how we can best provide supports for people. I know that's not a definitive answer, but it's everybody at this point has to think about their own safety plan.
Right.
Case by case.
Okay, thank you.
Yeah,
we're
we'll
getting a
help wherever
couple
we
of
can.
questions in the chat feature, so I'm just going to go over those to make sure everyone's questions are answered. This is from Jan, and it says, Arlena, if we are current direct service providers, do we have to go through our case manager to rush add employees?
So I'm sorry, I'm not seeing the question.
From
This is Arlena. Can you hear me?
Yes. Hi. Yes. Hi. So
Hi.
the question is, if we are current direct service providers, do we have to go through our case manager to rush add employees?
Is this under?
It's in the chat section, Mary.
Yeah, I see it. Is this
Jan.
talking about consumer directed?
Yes, I believe if they're already a consumer-directed employer, they're already with us, they don't need to go through CD to add employees. Only if they are not a CD employer already, they do need to go through DOH first.
Okay. And the next question is from Cynthia. It says, can you waive being the parent and sole guardian to become consumer direct PAB?
No, at this point, we are not waiving that. The parent would be, if they're the guardian, they would be the employer, and they would have other people provide the direct service.
Okay.
And a consumer director.
Cynthia, you spoke earlier about calling and then becoming. Can you restate what you said, and let's get some clarification on how that works?
And Arlena from Acumen, you're on the line?
Yes, I'm here.
So Arlena can also, she's the, along with us, the lead for consumer directed Acumen. So she could talk about those processes after Cynthia talks.
All right, I'll just do the overview. Consumer Direct was new to me, and I think a lot of parents who listen to this recording. So what that means, Consumer Direct, is you get the ability to pick and hire your own people, and the company acumen does all the taxes and all the paperwork for you, so it's pretty simplified. So what I'm doing is because my daughter has a fragile health condition, I did not want workers during the crisis to enter my house. So my partner and I are going to team up and be employer worker so that we can all stay isolated in the house with Consumer Direct. When this crisis is over, then they'll hire another worker or we will return to our agency.
Arlena, do you want to add anything about the process? Because, you know, it's step one, what do they do? Who do they call, et cetera?
Sure. Well, the referral should come from Department of Health and not just anyone calling us. So once we hear from the Department of Health that it's okay to process, we will reach out to the employer and the employees of that employer and fill out via the phone a worksheet with all the data that we need in order to set them up in our system. And then we'll make sure that they can verify that information. So we'll email them back, but they don't have to sign anything. They don't have to fill out any forms at this point, as long as it's temporary. If it's going to be permanent down the line, we'll have to do the forms. But for now, we can do everything over the phone simply and quickly. And once we get the information from the Department of Health on the budget, then we can get everybody set up, and we will let the employer know that they're ready to go, what that date is. So hopefully the whole process won't take very much, maybe 1 or 2 days on our end, depending on, you know, everything else, of course, involved. But in regards to Cynthia's situation, I had informed her that we would need to get clarification from Department of Health on whether she could be the employer since she's a sole guardian.
So I believe she can, but so what I'll commit to doing is they're developing the operational procedure, the part of it that families need to know. We'll get that up on our website and also push it out to all our case managers.
Mary, and there's a request if you could share the PowerPoint maybe on the website, or is there, that was
Yes.
really helpful.
Yes, I will.
Thank you. Thank you. All right, let's see. Here's a question from Debbie. It says, what does ADH service in a licensed care home look like? Who specifically would do this?
So it would be the ADH worker, and it would look a lot like PAB in terms of doing those, you know, working on the person's goals, making sure that they are doing okay in the home. So it could be, again, done as a direct service, kind of retrofitted to be PAB-like, or it could be telehealth if that's a better match or an okay match for the person.
Okay, thank you. There's another question that says, can one parent be the employer and the other be the employee?
I believe so. I will clarify that.
Okay, thank you.
But
go
again,
ahead.
if that person is the guardian, the other parent is the guardian, that might be an issue because we've been told that there's a conflict of interest there.
Okay, thank you. There's a comment about suspending respite hours. Someone asking why.
No, we're not suspending respite.
Daintree, do you want to
I'm sorry.
clarify? Because the hours are not being suspended. I believe they're removing the limit, which is good news, right?
Right, in the chat box, there's a question saying, why are you suspending the hours, the 700 whatever hours of respite? They're not being suspended. I just wanted to clarify that.
Thank you.
Thank
so I'm looking for that slide just so I can put that back up because I may have either misspoken or need to clarify. So this is the slide. So we're suspending the 760 hours of respite per year. So we had a limit of 760 hours. So you may have read that suspend 760 hours, but it's not that. We're suspending the limit and adding additional settings.
It's really good news.
Thank you.
Thank you.
Kind of a different, thing.
Well, we've gone through our questions here. The only question we haven't gone through, I don't believe you're going to have an answer to, and that is, when can we expect this to end? And I'm assuming you guys will just go with the state, right? I mean, we'll just kind of play it.
Well, my own view is the more people stay home and follow, being able to not have contact with others. I know it's hard with our population just because many of our family members do need to come into contact with people. That's kind of, and it may be, more than just verbal kind of intervention. So I know that's always going to be the rub. Practice infection control. Have anybody that comes into your home practice infection control, and we will see the end of this.
We've just got a few more minutes. If anybody else has a question, please put it in chat. I see one here. Will CLS services be charged to PAB?
Yes, CLS will transform to PAB.
Okay. Does anyone else
Joelle
have
had
a question? Oh, go ahead.
Joelle had a question, right?
Noelle, did you have a question?
Joelle.
Oh, Joelle, I apologize.
Hi, yeah, I typed it in the chat room, but I'm not sure if the response was it's already in the presentation.
Do you want to just repeat your question, Joelle?
Sure. I was just wondering, right now we're under a stay-at-home order from the mayor. And I don't know if there's a difference if we do, for some reason, get a statewide shutdown from the governor, but I was just wondering, number one, should that happen, would DD still be?
Yeah, so I looked at the mayor's proclamation from yesterday, and where he had all those exemptions. So it's exempted home care for people with PD, and residential care for people with PD. It does not exempt like ADH kind of programs, group programs. Most of our ADH settings have already, as you guys probably know, shut down. I think there are times when certain ADH programs may have to bring somebody to the program just to be able to stabilize. So those are the kinds of things that I'm looking at, having some flexibility around. I would say that that the mayor's exemptions really cover us for home care, and we're really health care, but for that home care for people with DD and residential care, where most of this will be happening. If people need to go out safely, just know that the parks are closed, but taking a walk with all the precautions, I think are things that are also allowed, because I think all of us go stir crazy. There's only so much in the house time that that can be tolerated by some people. So, Joel, does that answer the question?
My other question too is, and like I said, I don't know if there's a difference, should there be a state order from the governor? Would that change things for you guys, or you guys would?
Well, we're informing the state orders. So, we're vetting things through our department about what we need.
Great. Thanks so much, Mary.
So, Joelle, you are concerned about those two things, people coming to your house, right? And frankly, I think that they're, if workers, of course, if they're exposed, they can't come. But, some may be home taking care of their own families and those kind of things. So for the people who are most at risk, we've asked case managers to really identify safety plans, backup staffing for those people. So work with your case manager around your own safety plan. I think that's what, Cynthia's case in point was, that they prefer not to have people in their home during this time. But we're going to try to incentivize providers as much as they can to hire people if they need to get people aboard. There's all those people that worked in restaurants who are unemployment now. We might, get them into our workforce at this point in time, but we also are, we have to make sure that our provider agencies stay whole and don't become a victim of the economics of all of this during this time. So we put things like that into our Appendix K.
Thank you. Tammy, did you have a question?
Hi, yeah, actually I have two questions. One is that in the past, Mary, consumer directed was not approved for those that were PAB level 2 or 3. I know those are old definitions. They needed additional supervision, which was incredibly difficult to find if you were doing consumer directed. So the first question is, under this Appendix K, are you lifting those requirements so that those with PAB level 2 or 3 can get consumer directed without the supervision levels? That's my first question. The second question is related to the proclamation. And you said that under the proclamation, ADH is not an exemption. They do use the word shelter for adults for the IDDD community, that if you have a shelter, you're exempt. And I think I want clarification that the word shelter doesn't include ADH. Under the law that was passed last week for the emergency paid sick leave, if there is a federal order for quarantine, then agencies or organizations that have to suspend services may be able to get 2 weeks worth of sick pay paid from the government if it fits those requirements. So I want to make sure that the word shelter includes or doesn't include ADH. So like if agencies do lay off people, they are going to get some kind of reimbursement from the federal government.
Right. So for ADHs and employment services, we put into the application that we are going to be allowing a payment to them. My first preference or line of action is that they redeploy their staff to homes wherever they can. But we are going to see if we can get a payment to the ADHs so that they stay solvent. The other part of your question around the people who might have higher level support needs, I will check on that, but I think we're allowing CD across the board. I will get that answer back out to people.
Okay, thanks, Mary.
And Tammy, if you have other ideas, please email me anytime.
Okay, thank you. Thank you.
There's a question for Mary about checking into families with 2 guardians, but I'm not sure who is asking. Does someone want to ask Mary that question?
I have that question down to ask my staff about that, my waiver wonk people.
Okay. Does
So that
anyone-
would be the question of, can one be the employer and can the other one provide the service? I will problem solve that with my staff today.
Thank you, Mary. Is there anyone else who has a question for these guys? Okay, this has been really a lot of very helpful information, and I am very grateful, and I know everyone on the chat is grateful to all of you, Mary and Pat and Daintree and all of our representatives from Acumen, everybody, MedQuest who's here. Thank you so much for taking the time to answer our questions. This is a time where everyone has a million questions, and I know you guys are all working overtime to get things done for our community. So we appreciate your work. Thank you.
We just appreciate your putting this together. This is very helpful. And if we can, if we need to do it again, because things are, again, very fluid.
Right.
And if there's barriers and that kind of thing, we'd like to hear about it. So let's stay in touch.
All right, well, we appreciate it. And I see this last comment. Mary did say that she would share her PowerPoint online. And so, so that will be available to everyone. And also I've recorded this meeting and it will be available on the Hawaii Autism Foundation website. And so you can go back and if you've forgotten some information, you can look it up again. But thank you very much to our experts and to everyone who participated, and stay well.
Thank you.
Thank you, everybody.
All right,
Thank
bye-bye.
you.
Thank you, Mary, very much.
Thank you, Daintree.
Mahalo.